record with everybody's permission. And I believe right now that that is recording. Hold on. Yeah, it should be. All right. So again, I'm Dura Sims and I'm a care navigator with Heart Hospice and Palliative Care. Although I have both professionally and personally dealt with dementia in my life. So I am trained and certified in dementia care. I worked at, in my opinion, one of the most premier memory care communities that you can be a part of. And if you're fortunate, however you choose to look at that, to be able to live at Silverado Memory Care, that is, or even not live there, but go and visit and participate. As Lynn and I, that's how we met when I worked at Silverado. They have amazing events that help those caregivers stay connected, and as well as helping people with dementia feel like they still have meaningful and purposeful lives. So today's presentation is called Stages of Dementia, Get Ahead of the Curve. What we're going to talk about, I get people asking me all the time when they're first diagnosed, well, what does that mean? Does that mean like I need to sell my house right now and move in somewhere where people are going to take care of me? Does it mean that I'm going to pass away right away, or I'm going to live and go through, whatever it is that the questions are? It's really frightening when you first get that dementia diagnosis. And it's really hard to kind of navigate what do you do next, because it progresses so differently in so many people. I always say dementia is the most predictable, unpredictable disease you will ever have. It follows certain similarities, but you can have 10 people in the room with the same diagnosis and all 10 people will present differently. So we're going to talk a little bit about the diagnosis, keeping in mind that I am not a nurse and I'm not a doctor. So some of the things that I suggest I get through sources like Area Agency on Aging, through Alzheimer's Association, various groups. And I always say, if you have specific medical questions, always speak to your physician, especially when it comes to some of the medications that are being used. But we'll talk about treatment, lifestyle and home remedies, other therapies, care and support for the patient, and care and support for the caregiver, help, resources, and direct services. So, why is my not working? There we go. So the dementia diagnosis. Diagnosing dementia and the type can be very challenging. Your doctor will review your medical history and symptoms, and they'll conduct a physical examination. They're likely to ask somebody close to you as well what symptoms you've been experiencing. There is no single test that can be done to diagnose dementia. Really, it's done post-mortem, and that's when they can verify that in fact you did have that. So your doctor's likely to run a number of tests that will help pinpoint the problems. They might do a cognitive and neurological testing, in which the doctors are going to evaluate your cognitive function, your ability to think. They may evaluate your memory, your language, your visual perception, attention, problem solving, movement, senses, balance, reflexes, and other areas that likely will change as you progress through the diagnosis. Other ways that they can look and see if there's neurological activity going on that can also show that there's dementia or Alzheimer's, are through brain scans, CT scans, MRIs, PET scans, different laboratory tests. And because dementia does go hand in hand with depression quite often, they'll also likely request a psychiatric evaluation. So dementia treatment. Most types of dementia can't be cured, but there are ways of managing your symptoms. As we know, dementia is a progressive degenerative diagnosis, but as I said earlier, how that progresses through every person is differently, and how quickly you see the different progressions take place depends on everybody. So in the beginning, people are likely to want to know, is there a medication that I can take to stop it or slow it down? Medication isn't designed right now anyways. There's not a cure for diagnosis. However, you can take medication like Aricept, Exelon, and Razidine, which work by boosting levels of the chemical messenger involved in memory and judgment. Again, when I mention medications, I stress the fact that I'm not a doctor or a nurse. If you have questions about medications, how they'll work with you, please reach out to your physician and ask them for advice on that. Although those are primarily used to treat Alzheimer's disease, these medications might be prescribed for other dementias, including vascular dementia, Parkinson's disease, and Lewy body dementia. There are multiple types of dementia. So if you think of like dementia as the big umbrella, and then there's types that fall underneath that umbrella. There's Alzheimer's disease, there's Lewy bodies, there's vascular dementia, frontal temporal, Parkinson's, Huntington's, Werner-Korsakoff, which I always say that incorrectly, but and then there's mixed dementias, post-operative traumatic brain injuries. There's all these things that follow underneath that umbrella of dementia. And so usually when you're talking to the doctor, it's one of the things they want to find out, what are your symptoms, so they can try to see, is it more specific in certain areas. Several dementia symptoms and behavioral problems may be treated initially using non-drug approaches, such as occupational therapy, in which the therapist will show you how to make your home safer, and they'll teach you how to cope with certain behaviors. The purpose is to prevent accidents such as falls, managing behaviors that may change over time, and preparing you for the dementia progression as it will progress. Knowledge is power. It's really frightening when you hear that you have that diagnosis, or somebody thinks that you have that diagnosis. But the more you know for yourself as well as for your caregiver, the more equipped you are to deal with what happens. So don't let anything create a fear that creates paralyzation. Allow it to be something that motivates you to become educated more about what's going to happen next, so that you can take better care of yourself and that your caregiver can also be prepared to do that. Modifying the environment that you live in is important as well. So you're going to want to reduce clutter. You're going to want to reduce noise so that you can make it easier for somebody with dementia to focus and function. And you may want to hide, as the disease progresses, things that can be considered safety issues. So sharp knives, maybe put those somewhere where they're not easily accessible. As somebody becomes more challenged with driving, hide their car keys. If that doesn't work and they're finding the car keys, or they're becoming aggressive about it, have somebody, a neighbor, maybe dismantle the battery so that they think they have their car keys, but they're not able to get out there and actually drive. There are monitoring systems as well. So oftentimes later in stages of dementia, you hear that people will wander. You can get monitoring systems, and of course, then there's also secured environments in which you can have somebody live as well, like a memory care community that becomes a risk to themselves for safety purposes. And then simplifying tasks. You want to break tasks down into easy steps, and you want to focus on success and not failure. Structure and routine can help reduce confusion in people with dementia. And it becomes important to realize that you're never going to win a battle or an argument with somebody with dementia. So being able to acknowledge, agree, and then redirect and move forward is going to always be your best bet in having conversations or giving tasks to somebody that has dementia. Sorry, my button's not working. Lifestyle and home remedies. Dementia symptoms and behavior problems will progress over time. Caregivers should try the following suggestions. So you want to enhance your communication. When you're talking with your loved one with dementia, maintain eye contact, speak slowly and simple sentences, and don't rush the response. Present one idea or instruction at a time, and use gestures and clues such as pointing to an object. Remember, their cognitive abilities aren't what they used to be. And so for you and I, with a healthy functioning brain, you can spout off multiple tasks and we can follow that. For somebody with dementia, you could say, Well, go down the hall, turn right into and that's where the bathroom's at. The lights on the wall. Well, that needs to be broken down into very simple steps for somebody with dementia so that it doesn't create confusion or frustration, and just understand that their brain is no longer functioning the way that it did when it was healthy. Encourage exercise, and throughout life it's so important. Shame on me, I'm going to take my own advice. It is so important to try to incorporate, not just for mental health or physical health, but cognitive health. It's important to exercise. It improves your strength, it improves your balance and your cardiovascular health. Exercise may also help in managing symptoms such as restlessness, which you hear about sundowning. People can become very restless and agitated. So the more that you get somebody up and moving, that can also help manage those symptoms. There's growing evidence that exercise also protects the brain from dementia, especially when, I'm going to apologize in advance, I have a new puppy, so forgive the barking. But especially when combined with a healthy diet and treatment for risk factors of cardiovascular disease. Some research also shows that physical activity might slow the progression of impaired thinking in people with Alzheimer's disease, and it can lessen symptoms of depression. Engaging in activities. This is so important. Plan activities for the person with dementia that they can enjoy. Dancing is always something fun. You can dance in the kitchen, you can dance in your bedroom, you can dance in a wheelchair. You just move, put on some music, and let the music flow through your body. And it brings joy and happiness, and it creates movement. Painting is something that is wonderful. Gardening, cooking together, although, give your loved one with dementia maybe the lettuce and let them tear that apart. It isn't about the outcome, it's about the enjoyment of what's happening. It doesn't have to be perfect, it doesn't have to be great. It just has to be something that keeps them engaged and gives them meaning and purpose, and also allows you to connect and enjoy time together. Establish a nighttime ritual. This is so important because at night behaviors will often worsen. Sundowning, that's where the word sundowning comes from, is it tends to be around that time frame, sundown, where you start to hear that people who have dementia will have more behaviors that act out. So try to establish good bedtime rituals that are calming and away from noise. So don't have the TV on loud. After you've had a meal and it's cleanup time, maybe remove them from that area and have somebody else do the cleanup, or get your loved one with dementia engaged while you're cleaning up with other people. And get them away from active family members. Little kids running around and playing and screaming. It's fun and there's a time for it, but definitely not in the evening. It can become agitating to somebody with dementia. And when you want to leave lights on in the hallways and the bathrooms so that you can prevent disorientation. If they're still mobile and able to get up and recognize they need to use the restroom, they don't need to be searching for the light and having greater risk for them. So make it easy for that person to maintain their independence as long as possible, but as safe as possible. And limit caffeine. If you discourage napping also, and you offer opportunities for exercising, that all can help ease that nighttime restlessness. Keep a calendar. A calendar is so important, even for us without cognitive impairment. It's important. Your days get busy, but it also helps you understand your medication. If you have your calendar, when you need to take it, daily activities, events that are coming up. It gives you something to look forward to also. So when you want to redirect your loved one with cognitive impairment, if they're getting focused and having a behavior or a habit that isn't benefiting them, you can always pull out that calendar, acknowledge it, say whatever the issue is, and say, oh, by the way, did you remember that on this day, let me rephrase that. Don't use the word, did you remember? Never a good word to use when you're talking to somebody with dementia. Just say, oh, we have this event coming up on the 22nd, and it can create a great way to redirect your loved one. Plan for the future. This is so, so, so important, regardless of whether you have cognitive impairment or not. Any of us could walk out of the door today, head to HEB, and be hit by a car on the way there. Lives change in the blink of an eye. You should always have a plan in place for your future that sets your family up or your caregiver up for success, where you're not doing things in the heat of the moment or reactively, but proactively. So develop a plan with your loved one with dementia while they still have the ability to participate and identify their future goals for their future, when they're still able to contribute and say what they would like, because that time is going to pass where they're not going to be able to tell you anymore. If you have the conversation beforehand, you know their wishes while they were still of sound mind or reasonable mind, and you're able to help that make those decisions as the disease progresses. Get involved in support groups. Legal advisors, family members, and other people may help in this process as well. You need to consider the financial aspect of your loved one. Do they have a home? Do they have bank accounts? All of those things. And how do you get them legally set up where a power of attorney is in place, so that you don't have to go through courts and try to get guardianship after the fact, but you've taken care of things beforehand. Safety and daily living concerns are going to be important. So you're going to want to think about, if you live in a 2-story house and that's no longer going to be an appropriate thing, do we want to move into different areas, independent living communities, skilled nursing communities, assisted living communities, or memory care communities, and understanding the different of what those long-term options are, as well as end-of-life care needs. It's all important. If you can have that conversation early on in the diagnosis, it'll save everybody so much feelings of guilt, anxiety, all the things that come along with this disease when you start having to make decisions for the person that can no longer make them for themselves. Other types of dementia, other dementia therapies. Sorry about that. I didn't think that sounded right. The following techniques may help reduce agitation and promote relaxation in people with dementia. Music therapy is amazing. I don't know if y'all ever saw the Glenn Campbell story, but if you haven't, I highly recommend it. It'll move you to tears. It's the most beautiful thing. But it's interesting that music will last through somebody's entire diagnosis. Somebody who is nonverbal can start singing a song all of a sudden when the music comes on, and it's amazing. So music therapy is a great source of helping somebody with this diagnosis. Light exercise. While you're still mobile, get walking clubs put together. Meditation, chair fitness. You can do chair fitness all the way throughout, as well as dance. Let the music move you. Watching videos together and creating photo albums together is not just a wonderful way for your loved one who has dementia to stay engaged, but their memories, they revert back to their youth and to their childhood. And so as you're putting family albums together, take that time to ask questions and let them speak and let them reminisce and remember. And it's a great opportunity to bond as family too, that you'll have those stories that you'll be so grateful that you did, and that you got those stories when you had the chance. And so photo albums are amazing. Put them together, keep them out and about where they're visible for your loved one with dementia to go through and thumb through. Pet therapy. Who doesn't want a pet, unless they're barking in the middle of a presentation, which maybe in that moment, not so much, but pet therapy is great. Bringing in dogs or cats, they can help improve your mood and change the behaviors of someone with dementia immediately. Aromatherapy, lavender is soothing and relaxing, but find different fragrant and plant oils that are soothing, that can help to relax somebody. And massage therapy. At times, later in life or later in the dementia diagnosis, it may become uncomfortable to touch that person. They themselves find touch painful. But there's different types of massage therapies. I believe it's called Reiki, if I'm saying it correctly, where they put their hands over you and it's not actually touching you. But there are therapies that you can do all the way through to end of life with somebody, massage therapies that are wonderful and soothing. And then art therapy. Art is a wonderful tool for giving somebody something to do. And as long as you can continue to keep the brain active and engaged, remember the focus isn't on the outcome, it's on the process, it's on what you can enjoy. So, care and support for the person with the disease. Receiving a diagnosis of dementia can be devastating. Many details need to be considered to ensure that you and those around you are as prepared as possible for dealing with this condition and its unpredictable, progressive way that it moves through somebody's brain. And again, it's different for every single person. So here are some suggestions that you can try to help yourself cope with the disease if you yourself have been diagnosed with dementia. You want to learn as much as you can about memory loss, dementia, and Alzheimer's disease. Again, knowledge is power. The worst thing in the world is having a feeling that something's different, something's changing, but you don't understand what's happening. So it's scary as it is, learn about it. It takes the fear away. It gives you a sense of having a little bit of control over the uncontrollable. Write down your feelings in a journal. Journaling is such a great way of getting emotions out, and it's also a great way of going back and sharing with others as this disease progresses. And I refer to dementia as a journey, because it's a journey. It is a very different journey, and journaling will help you through your journey. Join local support groups. Lynn is an angel, and Caregiving Cafe is just one of many support groups that people should reach out to. I'm a big believer in multiple support groups. You can never have enough support as you go through this journey with your loved one or yourself. Get individual and family counseling. Remember that dementia is a family disease. It does not just impact the person with that diagnosis, it impacts everybody around them. Counseling is very helpful. And I know a lot of people feel like, it's a sign of weakness to ask for help or to go to counseling. It is really a sign of strength, recognizing that you can't do it on your own. We're not designed as individuals to go through this journey by ourselves. That is why there is so much support out there, and there are different places, for somebody to live as the need progresses, if that be necessary. Talk to a spiritual counselor and community, or people who can help with your spiritual needs. Stay active and involved, volunteer, exercise, participate in activities for people with memory loss. Age of Central Texas has wonderful programs that if you have a diagnosis, really all the way through to late stage diagnosis, they have different things that can help you stay active for as long as possible. And then spend time with family and friends. Participate in online community groups of people with some similar experiences, and then find new ways to express yourself, maybe through painting, singing, writing, and delegate help with decision makings to someone that you trust. Helping someone with dementia. You can help the person cope that has the disease simply by listening and reassuring that person that they're going to be okay and that they can still enjoy life. And listen to that advice yourself, I always say, because you too will need to be reassured from time to time that you're going to be okay and you're going to be able to enjoy life. Being supportive and positive is so important, and doing your best to help the person retain their dignity and their self-respect all the way through the disease is important. We all want to feel like we matter, and we want to feel like somebody is hearing us and respecting us regardless. And that doesn't go away just because your cognitive abilities are starting to diminish. Caregiver support, how important is that, right? We're all on Caregiving Cafe because it is important to take care of the caregiver. If the caregiver can't take care of themselves, they certainly can't take care of the person that they love or that needs their care. So first and foremost, make sure you're taking care of yourself if you're the caregiver. Providing care for someone with dementia is physically and emotionally demanding, and feelings of anger and guilt and frustration, discouragement, worry, grief, social isolation, all of those things are common. You might feel like you're in a boat all by yourself and isolated, but when you start to talk to other people and you start to hear their stories, you realize I'm not the only one. that feels that way. I'm not the only one that's wanting to pull my hair out or wanting to yell and scream. It is okay to be angry at this disease, and it's okay to remind yourself that your loved one is still your loved one. You love them, but you hate what's happening to them. It's okay to express feelings of hate and anger and grief, because it's not with the person you love, it's with a disease that is taking away what is so unfair, that shouldn't be taken from us. And feel that it's okay. Express it and share it with other people, and then allow yourself to move on, because that's what's going to give you the permission to continue to live your life happily and to take care of yourself. Again, for the caregiver of somebody with dementia, learn as much as you can about this disease and participate in caregiving and education programs. Find out about supportive services in your community, such as respite care or adult daycare, where you can get a break a few times a week or at least once a week. Ask friends and family members for help. Take care of your physical, emotional, and spiritual health. And ask questions of your doctors and social workers and others that are involved in the care and support of your loved one, and join a support group. Your local area agency on aging, local Alzheimer's Association, your family doctors, they may all direct you to community resources that can support you as a caregiver to provide respite, and also services that include adult day services, and programs for meals, home health care, and other services. So getting help with Alzheimer's caregiving. Some caregivers need help with the person when the person is in the early stages of the Alzheimer's diagnosis. Other caregivers look for help in later stages. It is okay to seek help whenever you feel that you need it. As a person moves through the stages of Alzheimer's, he or she will need more care. One reason is that medication is used primarily to treat only symptoms of the diagnosis. It is not to cure the disease. It is a progressive degenerative diagnosis. And as of now, medication does not provide a cure. So symptoms like memory loss and confusion, those things will worsen over time. Because of this, you will need more help. Resources for Alzheimer's care. Here are some places that can give you support and advice. And certainly there are a lot more out there. I just put a few together, and because there are people that are not just in Austin that are on Caregiving Cafe that watch this, I did a lot of the national associations. So there's Alzheimer's Association, Alzheimer's Foundation of America, Elder Care Locators, National Institute on Aging and Information, and all the phone numbers that are there. I can go back to this afterwards if y'all would like to write that down if you haven't had enough time on this slide yet. Direct services and groups that can help with everyday care in the home. So there's home care services. That's not to be confused with home health services. Home care services provide aids like personal care aids, or they can come in and provide company for the person, but they don't provide skilled medical care. Aides are usually not medical professionals with home care services, but they can assist with activities of daily living, such as bathing and dressing, and they may even help with light housekeeping, transportation. They can run errands for you, and they can be there for a few hours, or they can live with you, be live-ins and stay 24 hours a day. The cost for the caregivers in general, they charge a flat rate if it's overnight, and then it can vary by what you need. It'll vary per agency as well. So whatever agency you contact, find out and interview a few and see what works best for you. Medicare and private health insurance may cover some cost, but usually non-medical care is not covered. You want to check with your health plan. Some long-term care insurances do cover personal care and homemaker services. Then there's home health services. So not home care, but home health. Home health is a skilled licensed medical professional who will come to your home if you're recovering from a stay from a hospital, illness or injury, or trying to stay at home successfully with added level of care from the medical side of things. They provide skilled nursing, physical, occupational, and speech therapy, and other medical services that can be coordinated by your doctor. And you do need to have a doctor's order for home health services. Medicare or other private health insurances usually cover skilled medical care in your home. So you want to check with your insurance provider always before signing any kind of an agreement. You must cover the cost, you must pay all costs that are not covered through Medicare, Medicaid, or insurance out of pocket. So do your research and make sure that if it's in network or things like that, always check with your insurance company before signing an agreement. There's different meal services that are very helpful. They can bring hot meals to people and have delivery staff that can deliver them to them, although they do not stay and feed your loved one. What to know about this: the person that has Alzheimer's must qualify for services based on local guidelines. Some groups don't charge for their services, others may charge a small fee. A great way of finding and learning more about them is to contact the Elder Care Locator helpline, or Meals on Wheels, which is in every county, every area, and they can also assist you with that. There's adult daycare services, which provide a safe environment and activities. They have a staff who pay attention to the needs of the person with Alzheimer's that's in the adult daycare facility, and they provide transportation. The facility may pick up the person with Alzheimer's, take him home, and then back to the care center daily, and they may return the person back home at the end of the day. They provide much needed break for the caregivers as well. And adult daycare services usually charge by the hour. Most insurance plans don't cover these costs, so you'll have to pay all costs that are not covered by insurance and out of pocket. But again, age is a great place for free services. And then there's the National Adult Day Service Association number here, and Elder Care Locator number here as well, so that y'all have that to contact if you need that. Respite services are also important. We are getting to the end. I'm sorry, I know it's taking a minute, but we're kind of going from start to finish here. Respite services provide short-term care for the person with Alzheimer's at home and in a healthcare facility or adult daycare center. They can last for a few short hours or last several weeks. Usually about 3 days is what you see, at least with us through hospice, that we can get for a respite stay. And it's to provide a break for the person who is giving the care, not necessarily for the person with the diagnosis. Respite services charged by the hour or by the number of days or weeks that services are provided. Most insurance plans don't cover these costs.
This is tricky.
What's that? Okay. You may pay all costs that are not covered through insurance or find other funding sources. Medicare will cover the cost up to 5 days in a row of respite care in a hospital or skilled nursing facility for persons receiving hospice care. Typically that's 3. I think this is a little dated. And then Medicaid may also refer assistance. One second, let me get that. Is everybody still there, or did I lose everybody? Can y'all still see me and hear me? Yeah. Okay, great. All right. There's geriatric case managers also that can assist with care, and you would speak to them individually about the cost of that. And then lastly, there's hospice services. So hospice services can provide care for the person who is near the end of life and no longer receiving treatment for care for serious illness. Hospice services keep the person who is dying as comfortable and pain-free as possible in the home or in the facility that they're living in or that they call home. They also support the family by providing end-of-life care, and you can stop hospice services at any time if you wish for curative treatment again. Usually hospice is always covered through your Medicare benefit, through Medicaid. Some VA benefits and administrations will do it. Private insurance, some may have a hospice benefit to that. If you need hospice services in assisted living, nursing home, private care facilities, hospice can be provided anywhere that you call home. you can always reach out to me or any hospice company of your choice. You do not have to have a doctor's order to have an evaluation. You do have to have a doctor's order